Hi, this is Pat Clay. This is a narrated PowerPoint on starting an IV, specifically how to choose a site. One of the first steps in starting a peripheral IV is to locate a good vein. Consider the amount of time the PIV needs to be in place. Is it going to be 3 hours or 3 days? The patient may need to be showering with the PIV in place. Look, and look some more. Find a vein with the following characteristics. The vein must have brisk, unimpeded flow of blood, meaning a straight filling vein unimpaired by valves, which appear as knots or lumps in the vein. The site should allow for joint movement. The site should allow for securement without protruding loops of tubing that could get caught on something. Assessment of these three considerations. On the next several slides, note the flow of blood as the vein refills after pressing the blood out toward the hand or distally. Note if the location would impair joint movement. Note how PIV securement might be a problem. This first example is the cephalic vein in the inner left wrist. Test refill by pressing downward away from the body. Slowly release the pressure to allow the blood to flow back into the vein as you note how the vein refills. There's a puffier portion of this vein proximally with an indentation at the bend of the wrist and then a distal bumpy portion indicating valves where other veins join in. This is not ideal, although you can see a straight quick refill. Keep it in mind as a possible site. Additionally, the site is at the wrist joint, which might impair movement. This next example is on the dorsum of the left hand. Note that the proximal portion of this vein does not collapse, indicating a valve or a place where two veins join together. The distal portion collapses, indicating straight refill below the valve. But you don't want to have to thread past a valve. However, the vein below the valve is a little tortuous, which might impede threading of a cannula. Additionally, if the tubing extends beyond the knuckle, it has the potential to get caught on something. Here is the dorsum of the right hand. Note on the third swipe that the vein looks straight and that there is even refill except for a proximal portion. This site is not on a joint but may have securement issues if the tubing loop extends beyond the knuckles. This is the dorsum of the right hand. Notice the straight vein, and it has brisk refill, no valves, it's not on a joint. Securement might be an issue if the tubing loop extends beyond the knuckles, and it would be easy to cover for a shower because it's on the hand. Here are cheater veins on the right wrist. Cheater veins are just that. They're like the last place you want to go. They're on a joint. Refill is questionable. They're very small veins, disallowing a catheter larger than maybe a 22 gauge. And they're very tortuous. Here's more cheater veins. They're on a joint. Tortuous. They have valves and bifurcations and are very small diameter. Here is an example on the right ventral forearm. Straight vein without valves. Brisk refill with fair diameter for a 20 gauge. It's not on a joint. securement would be satisfactory, and consider the sensitivity of this area and the proximity to tendons and nerves. Again, just showing the straight vein, no valves, and brisk refill. That's the kind of vein you want. That's not a good one on that right side. There's a lot of vein location equipment that might be available where you work. This equipment uses infrared light technology to locate veins. You still have to test for valves with refill and consider joint movement and securement. And a cubital is usually the place where the ER is going to start an IV for you. It will restrict joint movement, however, those are very large, easily accessed veins. Hey, just for fun, did you ever hold a flashlight up to your hand on a dark night? This is called transillumination. The old flashlights would get hot, so a cool LED light source flashlight is needed. Using illumination to locate a vein, make sure it's a cool light source and darken the room as completely as possible. Here's an example using a regular flashlight to illuminate veins on a hand. You can see the veins are tiny and tortuous. Any securement would cause the loop of the IV to extend beyond the knuckles. They're very tiny also, not allowing for a very large gauge catheter.
Where's your hand? That's the way I need to go. Redo that. Where's your hand? That's the way I need to go.
Consider an otoscope to illuminate. I've actually used an otoscope to locate a vein, and it's usually handy in a clinic or acute care setting. The light source is always going to be hot, most likely hot, so check first. This is a product called NEOTECH NEOGLO Transillumination light for neonates. It has a forward-facing light and then an upward-facing light for different positions. You can see on this top picture it's in a foot, and on the bottom one in an ankle. Neonates and babies are much easier to transilluminate because the density of their muscles and limbs is very small. An adult has a higher density, so it's going to be impossible to use this on an adult. Another product by Philips is the WeSight LED illuminator. I hope this focused PowerPoint was helpful. Here's a few final tips. Keep in mind that you should never start an IV anywhere below the waist on an adult if possible. The scalp is an acceptable site for an infant, but keep in mind that a severe infiltration or extravasation can lead to disfigurement or nerve damage. If the site is close to nerves and an infiltration occurs, there could be nerve damage. Consider warming a possible site with an approved warming product prior to assessment. The warmth will increase blood flow to the vein, causing it to be distended and more easily accessed. Work quickly as you thread the catheter as you perform the initial stick, because a sudden spasm of the vein might cause the vein to disappear, making the procedure harder or impossible. If you have any questions or comments, please email me at profclay2020@gmail.com.